From schools to flights, a new coronavirus wave is disrupting all walks of life here in the U.S. Residents in New York City are experiencing subway and bus delays. According to the city's transportation authority, nearly 1,300 people are out sick with COVID. Hospitals in several parts of the country are also at a breaking point due to increasing rates of infection among medical staff. Nikki Battiste has the latest from New Jersey.
At Holy Name Medical Center, 106 employees are out sick, 26 of them nurses.
I'm worried a lot about burnout.
The staffing strain is also hitting schools. Classes were canceled for a second day at Chicago public schools after union members cited unsafe working conditions. And in San Francisco, teachers staged a sick out over COVID precautions. Here in New Jersey, nearly 6,000 hospital workers have gotten COVID since Christmas. Now the state is asking the National Guard and FEMA for help.
Are you worried about just not having enough fellow nurses?
It's always a worry.
Nurse Lauren Boniello says the pandemic has been incredibly difficult as they've lost patients and co-workers to COVID.
In the beginning of the pandemic, we lost an employee, and so it was a challenging day. It was a very emotional day, but it was something that we got through together.
In that moment, what's going through your mind?
Hold on a minute.
I'm sorry.
You're right.
Almost 2 years later, they're still pushing on.
We are here for any patient that walks through that door.
Right now, there are 77 COVID patients here at Holy Name. Of those in the ICU, all but 2 are unvaccinated, and the 2 who are have underlying conditions making them prone to severe illness. Lana?
Nikki, thank you. For more, I want to bring in Dr. Anand Swaminathan. He's an emergency medicine physician at St. Joseph's University Medical Center in New Jersey. Dr. Swaminathan, welcome back to the show. As we saw in Nikki's package, your state is seeing an alarming spike in infections, hospitalizations, and deaths. We also saw the emotional toll that that's having on healthcare professionals. Can you talk to us about this and how it's impacting you and your peers?
We're seeing really tight staffing. We're seeing, again, patients very sick from COVID-19 and lots of unvaccinated patients still unvaccinated in spite of everything that we've gone through. And that combination is very difficult. It's really hard because we're exhausted. We're physically exhausted, we're mentally exhausted, and we're emotionally exhausted. And having that empathy for our patients is really important. And we're having a hard time, at times we're having a hard time generating that empathy because we are so mentally and physically exhausted. We know that these vaccines are working, but we are having a hard time convincing people to get them, which is really tough. And I think one of the things that really frustrates us is the fact that while we are being asked to work when we're not feeling well, we're being asked to go into a second and now a third year of this pandemic, we're not seeing the proper public health initiatives around the state that can help us. Where are the mask mandates? Where are the vaccine mandates that we need to support our work? We're just not getting that support. And so, I go to the supermarket and I see more than 50% of people without masks on. That's ludicrous when we're in the middle of such an intense surge.
Do you think that that's because with this current surge, it seems like so many people are getting it? We're hearing that the infection is not as severe, and so that there's just become sort of a combination of fatigue and a group of people that are just throwing up their hands and not being concerned about COVID anymore in a way that you and your colleagues in the medical field don't have the ability to give up.
I think that's a big part of it. I think there is some exhaustion overall in the population. And that's why public health initiatives like mandatory masking need to be real mandates. They need to be kind of placed onto the public, and the public needs to understand how important those things are, because you're right. Most of the public doesn't know what's happening in the hospital until they end up there. We know what's going on. We know how overwhelmed they are. And we know that when people need the hospital, there's a chance that the hospital won't be there for them because we are so full. And so I think we really need to, again, be looking at what mandates, what things can we do to reduce the number of cases. This is just one of them. And, this goes along with things like reduced indoor capacities for restaurants, for bars. The fact that we're talking about closing schools but not closing bars and restaurants, it doesn't make a lot of sense. So there are some things that we can do to help to support hospitals, support healthcare workers, and kind of suppress the number of cases that are happening.
So according to state data, New Jersey has seen 9 consecutive days with more than 20,000 confirmed positive test results. It sounds like you want local and state officials to try and control the spread with more mandates. Is there anything else that you think that lawmakers ought to be doing?
Well, I think that's a big start. Part of it is getting those mandates in place, vaccine mandates, mask mandates. Getting our testing capacity a little bit more robust is a big one, too. We have a little bit of a winter storm that's coming in, and a lot of test centers have already announced that they're going to be closed, which means people aren't going to be able to have access to that testing if they should need it. Now, hopefully, if the weather is bad enough that you can't go and get a test because those centers are closed, people will stay home, and that in and of itself can help to suppress spread, although this is only a day-long kind of snowstorm. But these are some of the things that we need. A lot of the things that we really need are going to be bigger picture type items. We need real investment in public health infrastructure. We need investment in ventilation and filtering of the air for schools and for all businesses. These are more long-term things. Of course, we talked about this a year ago and said these are long-term things, and yet we still haven't really seen movement on them.
You know, another thing, Dr. Swaminathan, that's got people worried is so-called flu-rona, a combination of influenza and COVID infections. What more can you tell us about this? And if people get both the COVID booster and flu shots, are they able to be less concerned?
Yeah, absolutely. You know, flu, the same mitigation strategies that will help with COVID will help with influenza. So if you're wearing your mask around, if you're wearing a high quality mask, and honestly, at this point, Lana, we should all be moving towards N95 or KN95 type masks, that will protect you against the flu as well. So the masking is going to be a big part of avoiding flu, avoiding COVID as well. Vaccinations, flu vaccine, it's not as effective as the COVID vaccine, but it's still pretty good. And if you get your flu vaccine, even if you get flu, you are more likely to have a more mild course. So yes, vaccines are going to be extremely helpful. The truth is that getting flu and getting COVID at the same time sounds pretty miserable, even if you have a relatively mild course of disease. It still sounds pretty bad. I had the flu once a couple of years ago, and I promised myself that I would make sure 100% to always get my flu shot to try to avoid that. But the typical things that we can do, washing your hands, wearing your mask, avoiding indoor gatherings, that'll help to avoid the flu, just like it'll help to avoid COVID.
You know, Dr. Anand Swaminathan, I say this to you every time, but I hope that it still sounds significant. Thank you for all that you do.
Thanks.